and other her colleagues from the hospital also in attendance. My co-workers and the BARMM, headed by Executive Secretary Abdul Rauf A. Makakwa, also the co-chairman of the interagency, Bangsamoro Interagency Task Force, along with Minister Dr. Safrullah Dipatwan of the Ministry of Health, Minister of Public Works, Minister Edward Guerra, our Cabinet Secretary, our Assistant Executive Secretary, and other co-workers in the BARMM who are here with us. I also see Dr. Pangato of the Sanitarium Hospital. Maybe we'll be engaging also with him later on, inshallah. And then we have also Dr. Kadiel Sinurining, our former DOH in the ERMN. So, thank you very much for attending this gathering today. Actually, after the declaration of public health emergency in the country, the Bangsamoro government immediately constituted its Bangsamoro Interagency Task Force on COVID-19 to discuss and implement policies and actions to combat the disease and to protect the Bangsamoro. As part of the Bangsamoro Interagency Task Force strategies, we have been supporting our health workers and health facilities through augmentation of PPEs and other medical supplies and equipment. We are one of the first in the region to do so in Mindanao. And the CRMC was actually one of the first hospitals to receive such needed support from the Bangsamoro government. During our discussion, with some experts on the field of humanitarian and public health emergency response, our strategies and plans to address this crisis circles around the need for a faster and more testing of possible COVID-19 patients through a reliable testing method such as the PCR. We will be able to have a more strategic approach in our community quarantine. We will also be able to have a better picture of the magnitude of the problem if we have a reliable testing method. Unfortunately, in our country, the testing method known as the PCR is still very limited, particularly during the earlier stages, in which it was only the Research Institute for Tropical Medicine, RITM, that can conduct such a test. The Bangsamoro Interagency Task Force on COVID-19, we're trying to look at different options to address this gap. We closely monitored the development of alternative testing such as the rapid test kits, but unfortunately, we find it not reliable, according to information, not reliable enough to be the sole basis of testing. We also look at the possibility of using Gen Expert machines, but the cartridge needed is not yet available. Unlike the rapid test kits, it also has its own reliability, issue of reliability. We also considered building a dedicated laboratory capable of COVID-19 testing, but we understand that this might take a while before accomplishing. Hence, our option at the existing situation is to see and evaluate the capabilities of our hospitals in the region, in which it was found out that among the hospitals and medical structure in the region, CRMC is the closest among the hospitals in meeting the requirements and technical capabilities of conducting PCR or laboratory tests for COVID-19. We are very happy because at least we already have an initial engagement with a partnership with the CRMC. And it was also very timely that as we were discussing and pursuing this direction, we received the request from CRMC. Request for assistance in order to upgrade their capability. The Bangsamoro Interagency Task Force on COVID-19 did not take a long process to discuss and immediately endorse such requests for approval. On my part, I see that approving it was not only a duty but a responsibility. So I outrightly also approve the request for assistance. Now, the Memorandum of Agreement that we are about to sign this afternoon with the Cotabato Regional and Medical Center is an example of strategic partnership that we have been espousing in the Bangsamoro government as part of our 12-point priority agenda, that is medical services. The Memorandum of Agreement will formalize the more than 14 million pesos worth of assistance that we will be giving to CRMC for upgrading its laboratory, and this will make them one step closer in being an accredited and capable laboratory to conduct the very important PCR testing for COVID-19 patients, inshallah. This document is a symbol of hope and a strategic step in our fight against COVID-19. Indeed, we are in difficult times. We are dealing with an enemy that we cannot see with our naked eyes, an enemy that has overwhelmed our healthcare system worldwide. But through our cooperation, understanding, and strong faith in Allah, we are confident that we will overcome these challenges, inshallah. Together, we will heal as one. Together, we will beat COVID-19. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, sir. At this point, we will now be proceeding to the signing proper of the Memorandum of Agreement between the Office of the Chief Minister and CRMC. So, may I request the Chief Minister and the Medical Chief of CRMC to kindly occupy the seats at the back. Closing na lang. Ha? Ay, para sa mga witness. Okay, so diretso na tayo closing. After closing, after photo. With the officials. Oh, yeah. We will have another round of photo opportunities after the closing remarks with other officials of the BARMM. Mamaya na yung photo ops daw. Closing na lang muna. Closing na muna. Distance. Medyo. Distance. Yes. May we request a bit of physical distancing po sa ating photo ops? Dapat diyan nila yung Ateneo. Pinasa na lang lahat. Nang copy ng MOA. MOA? Paki-publish kami yan. Okay, now we will proceed to the closing remarks. And to give us the closing remarks, I'd like to respectfully call the Minister of the Ministry of Health in the Bangsamoro Autonomous Region, Dr. Safrula M. Dipatuan.
A'udhu billahi minasyaitanir rajim. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. We are gathered today in this very significant event to witness the MOA signing between the Cotabato Regional Medical Center and the Bangsamoro Autonomous Region in Muslim Mindanao. We are forging a very strategic partnership in order to enhance the effectiveness and efficiency of our response to the COVID-19 pandemic. The war against COVID-19 is a difficult one. We have witnessed how developed countries in the world are reeling due to the sudden and overwhelming impact of the COVID-19 crisis. Our economy and health system in the BARMM is far behind in comparison to theirs. One of our main strengths, however, in combating this deadly and invisible enemy is our unity as institutions of government and as public servants. It is in this context that this partnership becomes of utmost and strategic importance. We both have our own strengths and weaknesses. Let us capitalize on our respective strengths to counterbalance our weaknesses. This way, we strengthen each other and rally our fight towards victory against a formidable enemy such as COVID-19. We have no other choice but to fight as one. Currently, we are confronted with extreme limitations on testing. We have symptomatic patients suggestive of COVID-19, and some of them were discharged sooner than the availability of their laboratory results. Some of them also succumbed to the illness without the benefit of being tested at all. This is notwithstanding the fact that availability of testing centers is supposed to be mandatory. I am therefore expressing my thanks and appreciation to our beloved Chief Minister, Honorable Alhaj Murad Ahud B. Ibrahim, and our Executive Secretary, Sir Abdul Rauf Makakwa, including, of course, the Cabinet Secretary Yasnin Pindaton, Assistant Executive Secretary Dong Kosain, the OCM's Chief of Staff, Alvin, and of course, our Bangsamoro Attorney General, Attorney Lai Dumama Alba, for your kind understanding and strong support in transforming our humble initiative into reality. Thank you very much for your very meticulous review of the proposed MOA that finally resulted to our successful signing ceremony today. My thanks and appreciation too to my distinguished colleague and of course, Ikomare, Dr. Helen Yambao, the Medical Center Chief of CRMC, for her very good intention in welcoming our offer to help and her sincerity to cooperate with us. Let me not also forget my small brother, Dr. Shejan Kalim, our focal chairman on health in the Bangsamoro Development Agency. Doc, thank you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh.
Thank you very much, Dr. Dipatuan. I believe that officially ends our program for this afternoon. Thank you, everyone, for coming here today, and please enjoy your snacks.